In this video, we're going to talk about how to tell if you need a clitoris reduction or a clitoral hood reduction, which is a much easier procedure. Let me explain. My name is Dr. Clive Gallagher. I'm a plastic and reconstructive surgeon based here in Miami, Florida, with a special interest in genital procedures. And so typically when a patient comes to me with concerns that their clitoris is too large, or the medical term for this is clitoromegaly, they've usually already had a labiaplasty and very commonly have already had a clitoral hood reduction. And I see this time and time again that many patients explain that it has actually made their condition worse, because when they look down, now there's not really much hiding that clitoris and it seems even bigger. The reason for this, I believe, is most plastic surgeons are comfortable with labiaplasty and clitoral hood reduction because these are very simple surgeries where we're just reducing skin. So you don't have to be especially familiar with the anatomy of the clitoris to go in and safely get rid of the skin above it and shorten the hood of the clitoris itself. This is a good procedure when it's indicated, and it's commonly used at the same time as labiaplasty to balance and harmonize the genitalia. But if the main problem is true clitoromegaly or a clitoris that's too big, it can, of course, make things a little bit worse. So how to tell? One very common tell or giveaway that a patient has clitoromegaly is that when they get aroused, things to them look a lot worse. So a lot of patients will describe to me that the clitoris sticks out like a penis when it's aroused. It's normal for the clitoris to double in size, and this is usually one giveaway. You can tell by feeling the anatomy down there as well. If what is too big to you is the glans or the head of the clitoris, that's not going to be affected by clitoral hood reduction, and if anything, it's going to stick out and be a little bit more obvious because you're taking that skin that usually hoods it away. Other things is when you feel down there, if the hard firmness of the clitoris itself seems too big, if that bulk, especially when aroused, is too big, well, a clitoral hood reduction is not going to do anything for that. The clitoral hood reduction is just getting rid of extra skin there. The two procedures are very different. I offer both in my practice. I see a lot of patients who travel to me for clitoral reduction itself because it's not a very common procedure performed, because it's very delicate and you have to get in there and make sure we do everything we can to preserve the nerves and effectively reduce down the clitoris. How we do it is we have to somewhat deconstruct the clitoris. We're going to take that glans, which is the little tip that you can usually see, we're going to take that off along with its nerves, and you're left with the erectile bodies or the erectile tissues behind, which we're going to cut backwards depending on how much so we need to reduce the clitoris. And then after that, it's like origami, we're going to fold everything back into a natural position. Usually we're lifting things. A very common complaint is that the clitoris hangs too low, and so usually we're also doing an additional clitoral hood reduction, sometimes a labiaplasty as well, to balance and harmonize the anatomy down there. It's a much more involved procedure. Typically in my hands it takes about 2 to 3 hours to do it, as opposed to when I do a clitoral hood reduction it takes under an hour. So very different surgeries and very different involvement. So I hope this helps distinguish between the two procedures and what you may need to have done. We're accepting patients for this procedure currently here in Miami, Florida.